the study that I worked on was looking at the relationship between exposure to secondhand smoke and blood pressure in children and adolescents. And blood pressure in childhood matters because we know that higher blood pressure in childhood is associated with adult hypertension, which is strongly correlated with things like stroke, heart attack, heart disease. So we want to understand what these risk factors are early in life. So in our study, we used a national data set, which is a very large data set, to look at the passive smoking, which we measured by both parental self-report as well as measuring a biological marker for passive smoking, which is serum cotinine, a nicotine metabolite. And we looked at whether or not that was associated with higher blood pressure in both adults and children. And we found that, interestingly, that exposure, both self-report and serum cotinine, was associated with increased blood pressure, higher blood pressure in male children, but actually lower blood pressure in female children. We don't know exactly why what the biological mechanisms are that are responsible for this relationship, and that's something that would require more research. But this is one of the first studies on this topic, and certainly provides more motivation to look more into this topic. In terms of the implications of this, I think the passive smoking is a risk factor for increased blood pressure in children based on our study, but it's an avoidable risk factor. So if we think about this from a policy perspective, having things like smoking bans or reducing exposure for kids in their cars, things like that that can be done at a policy level, are beneficial to population health. But at the same time, from a household perspective or an individual perspective, if you're a parent that smokes, quitting smoking or reducing the amount that you smoke is beneficial both for your health and your blood pressure, but also for your child's. In terms of the next area of research for this, I think doing this study looked at exposure and blood pressure at the same time. And I think a next step would be to follow a cohort of children over a longer period of time to study how blood pressure would change with exposure over a longer period. And that would give us both a better idea of what these biological mechanisms could possibly be, and as well as help reaffirm what we found in our study.